ARM is an acronym for Advanced Resource Medic.
Basically an ambulance that has been retrofitted to provide additional care and definitive treatment for patients.
Basically what it is a way for us to provide mobile urgent care or definitive in-place care, whether it be the patient's home, office, or wherever they may be. My name is Kimmel Brent. I've been with West Metro for 10 years and a paramedic for about 8. And I'm an advanced practice paramedic who will be staffing the ARM car.
My name is Dawkins. I'm a nurse practitioner on the ARM car. So there's several ways that we can get called out to a call. Kimmel and myself have the ability to self-assign ourselves to a call if we feel like, based on the notes that we receive from dispatch, that it's an appropriate call for us. The other way, which will likely be the more common way, will be that a call will come in via the traditional 911 system. A medic crew or an engine crew will be dispatched out. They'll evaluate the patient as they normally do, and then based on their assessment, decide whether or not that patient meets criteria for the ARM car to come in and provide definitive care.
In the ambulance we have many diagnostic tools, an expansion of actual equipment that you would find in an urgent care setting, and we also have access to scheduling imaging such as X-ray and CTs and ultrasound.
The best way to think about it in a very clear and compact standpoint is anything that an urgent care can handle, we can handle. But there's also a fairly significant amount of gray area that most urgent cares can't handle that we can take care of.
So if someone has a nosebleed, oftentimes they end up being transported to the ER and they end up getting it cauterized either chemically or through heat. And then they're discharged within an hour or two. And that's something that we could do at their home. Lacerations are always a good example as well, something that's fairly straightforward. We can suture them up, go ahead and dress their wound.
We've seen everything from an auto pedestrian crash, the patient had a simple laceration from being struck by the car, to something as simple as a strep throat or a urinary tract infection. So what sets us apart is our ability to really perform on-scene point-of-care testing that would otherwise be performed at the hospital or in the emergency room.
So there's a couple advantages. First of all is financially. The bill is much less in this type of setting as opposed to an ER visit. So there'll be less of a financial impact. But additionally, there's a health and a psychological impact on many of these patients who will be staying at home, especially patients such as like Alzheimer's patients. And just the fact of them going into an ER, which is very confusing and it's unsettling to them, that can greatly impact their health later on, as well as their recovery for whatever condition they're experiencing. So in that regard, it could have, I guess, an overall health impact on the patient as well. In addition, the patients will be, just at ease in their home with their family and have the convenience of it being brought to them instead of them having to be brought to the ER.
And I think that it's one of those things, it's a great way to kind of think about it, is reinventing the house call, so to speak. There's a reason that house calls came about, and there's a reason that house calls were as effective as they were. And to be honest, I don't really know why they went away. Inevitably, it provides better care to our patients, and it's a better resource for our patients.
At West Metro, we always want to be patient advocates. It's really incorporating the whole system for the betterment of the patient.